If you get separation anxiety when your cell phone is not close by, you're not alone. It's a condition doctors call nomophobia, as in no mobile phone phobia. CBS 2's Reed Branson shows us how some local patients are coping.
Even while I'm sleeping, my hand is on my phone, literally.
It's more than a fixation.
It's kind of my security blanket.
Or a simple cell phone obsession.
And some people actually report panic just at the thought of not having their phone.
It's a condition called nomophobia, no mobile phone phobia, the fear of going without your cell phone.
It goes with me in the bath, it goes with me in the shower. I actually have a case, I think it's called Life Proof. And I put the case on and it's fully submergible in the bathtub.
Mary Helen Beatificato is a wife, mother of two, attorney, and the CEO of Morningside Recovery Center in Newport Beach.
Really, as a mom, there are so many things that I can do with my cell phone. I can order my school lunches. I can actually look at cameras that are inside my house through applications and check on my children when I'm not there.
She's a self-admitted tech junkie with 2 phones and an iPhone keyboard, who's also working through nomophobia.
And it's not like an ego thing, like I think, oh wow, everybody just needs me. But it's just so many people tend to rely upon you.
She's working with Dr. Elizabeth Waterman at Morningside Recovery Center. Waterman says some of the symptoms include
Frequently checking your phone, using it in inappropriate places, constantly making sure that the battery life is at full capacity.
Waterman says although it's most common in women 18 to 24 years old, it's not just a sign of the times. It's hazardous to your health.
So somebody with an unhealthy attachment to their phone may have thoughts of, I can't do my day without my phone. I have to go back and get my phone. It's the most important thing in the world.
Waterman cautions it's not a standalone disorder they treat, but usually connected to a larger issue like anxiety, something that patients come in for.
I do get extremely anxious because I don't want to leave a group or leave and go anywhere without knowing that I can somehow find a way back.
Christiana Ike is a patient at Morningside for PTSD. She, like all patients, had her phone taken away.
My phone is one of the only things left that makes me feel like I have any power.
Dr. Waterman says it's critical in a recovery environment to cut off connections to the outside world. But even for working professionals like Mary Helen, who says she feels expected to be reachable 24/7, she realized her nomophobia was a sign of anxiety she needed to manage.
The panic and anxiety that I feel during those, seconds that seem like minutes or hours is probably not normal.
Try to put your phone down for a certain amount of time each day. There is no magic number in terms of how long it should be put down, but just try to put it down for a while and then try to refocus on your face-to-face interactions.
Well, Dr. Waterman teaches patients distraction techniques to help ease the cell phone anxiety, like running their hands underwater, playing with sand, or even making small conversation.